When we look at diabetes prevention, there are actually several levels of prevention. Primary prevention is preventing the disease from occurring. Secondary prevention is controlling blood sugar in someone who has diabetes. We're trying to prevent complications of the disease. And tertiary prevention is trying to prevent organ failure and death in those who already have complications. So when we look at that spectrum of primary, secondary, and tertiary prevention, that's dealing with the disease as it progresses over time and gets worse. And where do we invest most of our resources? Well, it's in the tertiary care sector. So we put much more resources into things like dialysis and amputations and heart surgery or laser surgery for diabetic eye disease. And we put very little resources, relatively speaking, into primary prevention. So I think that we have a circumstance, not just in Indian country, but in our healthcare system more broadly, that we're willing to invest tremendous resources at end-of-life care, but very little resources at preventing disease in the first place. So when we have children in schools that eat unhealthy food and don't have physical education, the message that we're sending them is that we will not invest in your health as a child, but when you get diabetes and you get kidney failure, we'll pay for your dialysis. So when we have an industry-driven healthcare system, does a pharmaceutical company or a biotechnology company have an interest in investing in primary prevention? Well, of course not, because those industries depend on people being diagnosed with diseases like diabetes in order to survive. And in corporate America, profits drive decision-making. And certainly, there are plenty of companies that have profited tremendously off of the increased rates of diabetes in this country, not just in American Indians, but in the entire population. If we became very successful at preventing diabetes in this country, there are companies that would go out of business. So we have to recognize that we have a number of competing agendas when we look at issues like diabetes and social determinants. There has to be a paradigm shift in terms of placing a priority on health promotion and disease prevention. And that's not going to be done in the corporate sector. That has to be done through agencies and commitment on the part of elected officials. So if we're going to approach this intelligently and look at it from a public health perspective and a community health perspective, we need to recognize that we have to invest in primary prevention, and we cannot depend on the medical model to do that for us. We have to do it as community leaders in making our own decisions.
What are your wife and encouraging and being there for her? And it looks like you do that already, so that's good.